Today I want to talk about why you shouldn't wait to treat your hearing. I think really the number one reason why you shouldn't wait to treat your hearing is because it is not going to magically improve. What we see with hearing losses over time is they do stay stable for periods of time, but regardless, they will get worse at some point. And the best thing to do for yourself is to treat it when it's easier to treat it, which is at the beginning. It doesn't hurt and it happens super slowly. I always compare it to like a dimmer switch for a light switch. It doesn't go down really quickly, it goes down very, very slowly and in gradual stages. And if you were sitting in a room and someone started to lower the dimmer switch, if they did it slowly enough, you wouldn't notice until you were a certain amount in the dark. I tell my patients that all the time in regards to hearing loss. There are changes that happen that we adjust to, or that our brain adjusts to. Like, oh, I just don't hear well in this restaurant, so I'm not gonna go there. Or, oh, it's the streaming service that's unclear. If I just watch TV with subtitles on, like that's all I need to do, it's the speaker's fault. Or, oh, this person mumbles. However, eventually we get used to those adaptations that we make in conversation, until we're making them with everybody or with every place, or all of a sudden we don't go to any restaurants, or we can't watch TV without captions. And it happens in a way where we don't even recognize it, but then others start to point it out to us. And so I think there's real power in not waiting to get your hearing tested. It makes you aware of what is going on with you right now. What do I need to monitor? Is there something I can treat and improve upon? And how does this look for me going forward as I age, as far as healthy aging for not just our ears, but our brain as well? I think that's a big misconception, is that there's a certain age where you just get hearing loss and that's it. There is genetics to this, and in fact, genetics are almost more of an indicator of timing onset of hearing loss than anything else. Obviously, if someone has a job where all they do is test jackhammers or some loud machinery all day, they're going to have environmental stuff that will contribute to it. But what we see is that people's history or genetics, or when they saw parents, grandparents get hearing aids, has a big reflection on when they need to start looking at it or considering it. I strongly believe most people should start regular testing at age 50 because of this. So getting an updated hearing test every year to every 2 to 3 years, which is going to be recommended by your hearing care provider. Establishing a baseline is really the most important first step. Most people don't even get a baseline done until they're confident they have hearing loss, which probably means they had some degree of it for 7 to 10 years prior to that. And so part of it is knowing, okay, I haven't had a hearing test done since I was a child. Maybe it's time for me to look to do that, just because I know that this is something that is possible for me at this point in my life, or something I just haven't monitored, like you would get a dental cleaning or a vision check. Even with younger people, if you start to notice some ringing in your ears, it's called tinnitus. It is a reaction from your nerve. It's like a phantom limb syndrome, essentially, from your auditory nerve. You'll start to notice some buzzing or some like very, very high pitch ringing and quiet when you're trying to sleep or when you're trying to concentrate. And when that happens, that shows us that there has been some shift in your hearing. That doesn't necessarily mean hearing aid candidacy, but it does mean that something has changed. If we start to notice any of that, we should establish a baseline so that if tinnitus changes or if other secondary symptoms come up, we understand, one, when it started, what was your hearing like when it started, if we have to do follow-up evaluations for concerns for change, and two, is there actually a treatable hearing loss or a referral necessary for something that needs to be monitored by additional professionals. I also feel like younger people with concussion concerns need to get hearing testing. There's a massive correlation between hearing loss, tinnitus, and concussion, especially when it comes to being able to hear properly in noise. A lot of people think like, oh, I just lip read, or I just guess, or I just nod along. But when you're doing all of that, you're using extra effort. And we don't have any more energy to do things than we have. And so what ends up happening with people is when it becomes too difficult, we give up. And for me, that's the saddest part, is I can't imagine being in a room with a bunch of people you love and still feeling all alone because you're not a part of anything. or having to ask your partner or your friend after dinner, hey, what did they talk about? Or responding incorrectly. It's really easy for people with hearing loss, even at a mild one, to accidentally rhyme some words or misplace or mishear, and then might misconstrue the meaning of the sentence, which sometimes can cause like inappropriate responses. Other side effects people don't expect outside of it is anxiety. If we don't feel like we're hearing well during medical appointments, we can feel anxious around going to those appointments because we're not sure what our doctor is saying to us. Increased falls in the home. There is a very close relationship with hearing imbalance. It causes us to lose a little bit of spatial awareness in our environment, which can cause people to have more falls or more accidents. If we don't hear something correctly, it's hard to know if we remember things correctly. And then it feels like, oh no, is something going on with my brain? And my gosh, what a scarier, what a scarier thought. Like, I have concerns for my memory, but we ignore our ears in that pathway. And it's much of an easier solution to have hearing loss that needs to be fixed. And then we know, okay, is there a memory concern? And most of the time there isn't. We're just not hearing things correctly, or we're hearing things and we're rhyming them, which causes us to feel like we're not remembering correctly. It's something that is completely treatable and preventable too, which is it's such a massive thing to be able to tell people like, hey, you're gonna be able to connect with people again in a meaningful way. You're gonna be able to rely on what you've heard again in a meaningful way. It's empowering. It gives back a lot of independence and a lot of confidence. We have this issue where if we nurse an injury, we will create a secondary injury. And so that applies to hearing loss. Hearing loss, even though it doesn't hurt, can be somewhat of an injury. And so if you nurse it by ignoring it and starting to rely on lip reading or visual cues, we have seen on MRI studies that the pathway between your eyes and your hearing center in your brain gets stronger as your auditory nerve in your ear actually atrophies and dies off, creating a nerve that's very distorted sounding. The longer that goes, the harder it is for our nerve to tolerate sounds in those areas. And so you'll see people with what we call hyperacusis, or increased sensitivity to sound. For example, they might find it physically painful if they hear a baby crying. You might see people wearing earplugs inside of a restaurant because the level of noise feels painful to them, when in reality it's not painful. They're just not used to getting exposed to it, so it's an overstimulating or overwhelming sensation. Truthfully, I think the biggest misconception is that hearing loss is only for people who are quote unquote old. Like, what is old? Hearing loss is not a person's age. Hearing loss happens because of lifestyle. It happens because of genetics. It happens because of things that we cannot predict. The people who get hearing loss are all ages, all backgrounds, all experiences, whether it be in noise or not in noise. The people who get hearing loss, it's irrelevant to basically anything. It's just that they start to notice these things, and for whatever reason it is, lack of outreach or education or what we've been taught going forward, we assume that it can only happen at one point. The people who get hearing loss are the people who are noticing these difficulty hearing in noise, difficulty focusing or comprehending speech, difficulty hearing someone from far away. It's something that just because you don't think you are one of the people who should get it, doesn't mean you should ignore it. A lot of people want to wait until they see hearing loss get bad enough or severe enough, which when that happens, usually loved ones and family members are noticing that you're not hearing a lot more than what you realize. It's just you don't pick up on it till a little later. Hearing aids, when we treat with hearing aids at the appropriate time, they should seem somewhat unremarkable. Hearing aids that are making a massive, huge improvement on someone's hearing instantly are typically the ones who have a significant hearing loss, or something that they delayed treatment on for a long time. When we get hearing aids at the appropriate time, it feels like we're correcting your vision just a little bit, like a cheater. We're just clearing it up a little bit. We're not making it so we can hear everybody differently or everything differently, but what we notice is some of those voices that were harder for us at one point now don't require as much effort. We have other people telling you while you're wearing them, hey, you're not using the TV volume as loud, which is great. Or, hey, I need to tell you something quick, and they're way far behind you, and you turn around, you answer them. Another benefit of just getting a hearing test in general is, one, let's know if you have a lot of earwax in your ears. There is a lot out there showing that people have massive amounts of earwax. Let's know if it's you. It's hard to clean out your own ears well. You can't see inside there. So let the professional tell you what's going on in that respect. It can tell you, hey, yeah, you're seeing a little bit of change from all those concerts you go to. Let's get you some custom hearing protection, which allows you to enjoy the music at the concert without the damaging levels of loudness. Or that ringing is just something we have to teach you strategies on getting kind of shelved or tabled so that you can sleep well, that you can concentrate well. Or there is something here that looks like it might just be some congestion, or there might be some fluid in your ear. Let's get you over to ENT to get that managed. You should get your hearing tested because it is worth knowing how your body is doing. And the only way you can know how your ears are doing is by having a hearing test and knowing your hearing health. Thanks for watching. I'm Dr. Rachel Marston, audiologist and owner of Audiology of Apex. If you're in Apex, North Carolina, or really anywhere around Apex, North Carolina, we would love to meet you and help you understand your hearing health. Give us a call, 919-446-6002. Thanks for watching. I'm Dr. Rachel Marston, audiologist and owner of Audiology of Apex. If you're in Apex, North Carolina, or really anywhere around Apex, North Carolina, we would love to meet you and help you understand your hearing health. Give us a call, 919-446-6002.